For inflammation of tendons, many things could actually make your tendon get inflamed. All right, many things, infections, a lot of things. Now, for this type of tendon inflammation, we're just simply looking at, okay, there's a tendon inflammation, but it was caused by what? Calcium. So they call it the calcific tendinitis. Calcific tendinitis. So there's inflammation of the tendons, and this inflammation was caused by what? Deposits of calciums. So it's just a condition where what? Calcium deposits build in your tendons. Most commonly, they build around the rotator cuff. We're not saying it's only at this place, but this is the most common location. You understand? At the shoulders. So the deposits now, because there's calcium deposits, it causes what? Inflammation around that place. All right, and there's serious pain because a lot of tissues around that place are being irritated. You understand? So what causes it? Exact cause is not fully understood. All right, but most of the times is because maybe oxygen supply to that region is not really sufficient again. Maybe cellular changes, all right, have led to calcium being settling there. There sometimes is related to issues like what? Diabetes and what? Hypothyroidism. Okay, so who is affected? Mostly people aged 30 to 60, slightly more common in women, not necessarily linked to physical what? Activity. All right, so it's a calcium deposit right there in the tendon. So symptoms is there's so much pain. If the person wants to like move that part of the body, they can't really move that part of the body like others. Okay, so you still do imagings. That's for diagnosis. You do imagings like x-rays, ultrasound, MRI. This is because you want to actually confirm that there's what? Deposit of calcium in that tendon. So we have different stages of the condition. Pre-calcific, this one when it's all starting. Calcific, the calcium deposits, so maybe mild pain. Then resorptive is the most painful stage. The body starts breaking down the deposits. Okay, post-calcific, this is when you are trying to like heal. So health tissues are trying to like replace the deposits like that. Treatment, of course, is an inflammatory condition and a lot of pain. So non-steroidal anti-inflammatory drugs will be very important. Physical therapies, just to still maintain the mobility of the place. Then steroid injections, ultrasound guided needle lavage, right? Shock wave therapies. Okay, so that's just what if they talk about calcific tendinitis, that's what they simply mean. It's inflammation of the joint. All right, quite all right, but it's calcium deposits that actually what triggered it.